Hi, I'm Michelle McManus, your state senator for the 35th State Senate District. Thank you for tuning in this month. My show, In Touch with Northern Michigan. Today we have a guest in the studio, and my guest today is Mary Banfill.
Correct.
And Mary is part of the Michigan Community Blood Center's Cord Blood Bank.
Correct.
Is that correct?
That is correct.
And what's your exact title with this organization?
I'm the Stem Cell Laboratory Supervisor.
And what does that mean?
I kind of supervise the lab, which is a small lab. I've only got a couple employees. We provide grafts for the DeVos Children's Hospital bone marrow transplant program, and I direct the cord blood bank.
Okay. Let's talk a little bit about, just briefly, the history and some of the services that the Michigan Community Blood Centers provide for citizens in the state.
Okay. Michigan Community Blood Centers has been in existence a little over 50 years. We have a full-service whole blood facility with satellite blood centers and laboratories. The corporate office is in Grand Rapids. We also have blood centers in Saginaw, Traverse City, and Berrien County. Besides the whole blood that we collect and distribute, we have a reference lab, an HLA laboratory, a full education program that go into the schools and work with kids. We also have an adult bone marrow registry, and then my program, the Stem Cell Laboratory and the Cord Blood Bank.
Okay, and that's what we really want to concentrate on today. We want to educate our viewers about the Cord Blood Bank.
Okay.
And maybe we could start there and maybe give the viewers a short history of that.
Okay. The Cord Blood Bank at Michigan Community Blood Centers was created in 1999. We were the first cord blood bank in Michigan. There are currently only two. The other one's in Detroit. We arose out of a need worldwide for patients who are searching for bone marrow transplants and cannot find a matched graft. We'll talk about advantages in a little bit of cord blood over bone marrow, but there is definitely a need. There's still 20% of patients searching for a graft for their bone marrow transplant that cannot find an adequate match.
Okay. And let's talk a little bit about the public versus private cord blood banks.
There are two kinds of cord blood banks.
Okay.
The public is our program. The private companies are usually for-profit entities, and they bank privately for the family. The family pays a fee for that service, and then that bank holds it for them in case there's ever a use in that family.
Well, then let's talk a little bit, what is a cord blood bank? Maybe that's the first thing that we should solve here. So I bet many people don't know what that is.
Cord blood comes from the umbilical cord blood at the birth of a baby.
Okay.
The baby is born, cord is clamped and cut, so mom actually has baby in her arms. And the placenta is still full of cord blood, which is rich in stem cells. The doctor then collects the cord blood from the placenta before the placenta is actually delivered. And then that can be stored in a bank for future use. Right now, the only standard of care use for cord blood is for bone marrow transplantation. There's a lot of research going on worldwide to develop other uses for the stem cells in cord blood, but for right now, the only standard of care use that's non-research is bone marrow transplantation.
So you really have to be thinking ahead if this is something that you want to do.
That is correct. We encourage moms to call us by the time they reach their 28th week of pregnancy, and then we can supply them with the kit at that point.
So there's an actual kit. What would the kit have in it?
It has all first, a lot of paperwork. If you've ever donated whole blood, a lot of our questions are similar. We need to get a history on mom and dad, for that matter, to make sure mom's healthy and there will be no risk for the recipient of this cord blood. Also a genetic history and medical history of the family to make sure there's nothing in their history that would disqualify them from the program that would be dangerous for the recipient. So we mail the kit, which includes the paperwork. Mom fills out the paperwork and returns it to us, and then all the collection supplies are also in that kit that she brings to the hospital with her for the doctor to use at the delivery.
So the doctor and the nurses really collect the items?
Correct, and the midwives.
Okay. Is this very common then?
Probably less than 10% of our participating hospitals, less than 10% of the deliveries actually result in cord blood donation. We are pretty much constrained financially. Since we are a public bank, there's absolutely no cost to the donor. They are donating it to us, and they give up all rights to it at that point, which is different than the private companies where the family really maintains ownership of that cord blood unit. For the public banks, they donate it to us, so there's no cost to the donor mom. So our program's totally funded by charitable contributions. So we're constrained by financial difficulties. So we can only freeze. Our Michigan Community Blood Centers has made a commitment to allow me to freeze 350 of these a year.
Okay. And so, and those are the ones that are donated. So if I
Correct.
want, and how long can you freeze them for?
No one knows that answer
Okay.
yet. The technology is fairly new. They have successfully transplanted 10-year-old cord blood units. They think because we store them so cold, minus 190 centigrade, that all the metabolic processes cease and they may be good forever.
And have you seen where the donation has actually occurred in saving a life?
Correct. We have
Okay.
issued now 27 of these from our center. All of them, except one, successfully engrafted, which means those cells went to the recipient's bone marrow and started growing.
And they were from another person. They had no genetic
Exactly. Totally
identification.
unrelated.
Huh. Now, those, you talked a little bit about the private cord blood banks. When we talk about private, if the mom is thinking ahead and she saves the cord, and ultimately that cord can be used, is she or her family saving that for her own use or her own family? Is that
Correct.
what that's about?
That's what the private storage is for.
And how many of those are there in the state of Michigan?
I don't believe there's any in the state. There are many nationwide, and they service the whole U.S., but none of them are based in Michigan to my knowledge.
And there's only two public
Two
ones.
public, and about 20-some public ones nationwide.
Have you heard of stories or experienced people that used a private cord blood banking system then used the actual cord to help them or save
I only
family?
have personal knowledge of one of those, and it was done through DeVos Children's Hospital. They banked it with the knowledge that an older sibling had leukemia. So there was a reason for them to be banking in a subsequent child. And we will facilitate those at Michigan Community Blood Centers. We call those medical need donations, where there's already a situation in the family that would make it likely that that would be used. The strictly private banking has been termed biologic insurance. The American Academy of Pediatrics has come out with a policy statement saying that it should not be encouraged just for biologic insurance. If there is an existing need in the family where it's likely they will need a subsequent sibling's stem cells, that's encouraged. And we will facilitate those at Michigan Community Blood Centers and do them at our own laboratory.
And there's really no controversy when we're talking about cord blood banks.
Correct.
It's pretty, self-explanatory.
Correct.
And,
There's nothing like embryonic stem cells. There's no way we can produce a human life from these cord blood stem cells.